안녕하십니까. 서울대학교 치과병원 치주과 교수 조영단입니다.
Hello, I'm Professor Cho Young-dan from the Department of Periodontology at Seoul National University Dental Hospital. Today, I'll be conducting an online surgery session with you. Before we begin, let me briefly introduce our patient of the day. The patient is a 70-year-old female who is scheduled for implant placement following the extraction of tooth number 27. For this case, I'll perform a sinus lift using the crestal approach on the maxillary sinus. After sinus lift, I plan to proceed with bone grafting using AOss's AOss collagen. The patient is missing teeth number 27 and 37. She has hyperlipidemia and is on medication for it, but is not taking any anticoagulants. So surgery will proceed without any need to halt medication. Additionally, she has been receiving ongoing periodontal treatment for periodontitis. Let's take a look at the panoramic radiograph. As you can see, both teeth number 27 and 37 are scheduled for implant placement. Tooth number 26 does not appear in optimal condition with significant alveolar bone loss attributed to periodontitis, resulting in severe resorption of the alveolar bone. Now, examining the CT scan for site number 27, the bone height at this location measures approximately 6.3 millimeters. Today, I plan to place a TS3 implant 5.0 by 8.5 millimeter implant. I'll use CAS kit for a crestal approach, sinus lift, and perform bone grafting using AOss collagen. Although the adjacent tooth shows some bone loss and mild mobility, the patient prefers not to have it extracted. So we will leave it as it is and proceed with implant placement for number 27. Today I have placed implants for both number 27 and 37, but today I'll focus on number 27 in this online surgery session.
오른쪽으로 살짝만 돌려주시고. 해주실게요. 크게 한번. 네. 크게 한번. 크게 한번. 네. 조금만 더 크게. 네. 해보실게요. 하이스피드 한번 돌려주세요. 크게 한번. 크게 한 번만 돌려볼까요? 크게 한 번. 네. 안에서 펴는 이거 안에서 펴주세요. 40이요. 이거 안에다. 아파요. 입술.
Today's surgical video, which focused on placement for number 27, including its sinus lift and subsequent bone grafting, was shown. Let me share the clinical results with you. The implant was placed in the accurate position. After connecting the healing abutment, suturing was done. Let's look at the panoramic images. As planned, in number 27, TS3 5.0 by 8.5 was placed, and the same implant was placed in number 37 as well. The patient will receive implant prosthesis in about 3 to 4 months. I know everyone is curious about not only the surgical process, but also the clinical outcomes after the prosthetics. I'm curious as well. I'll continue to follow up with this patient and share the results with you. I hope today's online surgery session was helpful for all the doctors watching. I look forward to seeing you again in the future. This has been Dr. Jo Young-dan from Department of Periodontology at Seoul National University Dental Hospital. Thank you.